Good evening. This is All India Radio, Kohima. I'm Jonas Yantan with Evening News. The headlines. Centre extends ceasefire agreements with NSCN, Neokpao-Khitovi, NSCN Reformation and NSCN K-Khango for 1 more year till April next year. 168,912 new COVID-19 cases reported in the country in the past 24 hours. Centre bans export of Remdesivir and its active ingredients till COVID situation improves in the country. And Dimapur Police says newly constructed bridge over Dhansiri River will be open for one-way traffic only. Of COVID cases are on the rise again. We appeal to our listeners not to lower the guard, follow all the precautions, and all those above 45 years to get vaccinated without any hesitation. Stay safe and protected by following these 3 simple steps. Wear a face mask, focus on hand and face hygiene, and maintain a distance of 2 yards for social distancing. Now the news in detail. The centre today extended its ceasefire agreements with 3 Naga groups: National Socialist Council of Nagaland, NSCN Neokpao-Khitovi, NSCN Reformation and NSCN K-Khango for 1 more year till April next year. In a statement, Ministry of Home Affairs said the ceasefire agreements are in operation between the Government of India and NSCN Neokpao-Khitovi, NSCN Reformation and NSCN K-Khango. It was decided to extend the ceasefire agreements for a further period of 1 year with effect from 28 April 2021 to 27 April 2022 with NSCN, NK and NSCNR, and from 18 April 2021 to 17 April 2022 with NSCN K-Khango. These agreements were signed today. A total number of 168,912 new cases have been reported in the country in the past 24 hours, taking the cumulative positive cases to over 1,38 lakh. The Health Ministry said 904 deaths have also been reported during the last 24 hours, taking the toll to over 1,70,000 across the country. The country's COVID-19 recovery rate is at 89.86%, with a recovery of more than 75,000 patients in the last 24 hours. The ministry said that more than 1,21 lakh patients have already recovered from this disease. Presently, the total number of active cases in the country is over 12 lakh 1,009, which comprises of 8.88% of the total positive cases. The centre has prohibited exports of injection Remdesivir and active pharmaceutical ingredients of Remdesivir till the COVID situation in the country improves. Union Health Ministry said India is witnessing a recent surge in COVID cases and there are over 11 lakh active COVID cases. This has led to a sudden spike in demand for injection of Remdesivir used in treatment of COVID patients. The ministry said there is a potential of further increase in this demand in the coming days. The ministry said all domestic manufacturers of Remdesivir have been advised to display on their website details of their stockists and distributors to facilitate access to the drug. It said drugs inspectors and other officers have been directed to verify stocks and check their malpractices and also take other effective actions to curb hoarding and black marketing. The state health secretaries will review this with the drug inspectors of the respective states and union territories. Following the inauguration of the new RCCT beam bridge over the Dhansiri River tomorrow, Dimapur Traffic Police has informed that the bridge will be opened for one-way traffic from Purana Bazaar to Down area only. In a press release, Additional Deputy Commissioner of Police, Crime and PRO Dimapur stated that the arrangement is being done for the smooth flow of traffic and public convenience. It further requested all to abide by the new traffic regulation. This news comes to you from All India Radio, Kohima. You can also listen to this news bulletin on our YouTube channel, AIR News Kohima. Micro, Small and Medium Enterprises Minister Nitin Gadkari has said that the government is committed for the uplift of MSME sector in the country. He said the government is taking several steps to increase the contribution of MSMEs industries in the economy, facilitating export capabilities and generation of jobs in this sector. He added that these steps will generate 5 crore employment in this sector. While addressing a conference on digitalization, the key for MSME's rise to resilience today, the minister said the overall contribution of MSME sector in the economy will be enhanced to 40% from the present level of 30% in the coming years. The expert panel of the Central Drug Regulator, DCGA, has recommended emergency use authorization to the Russian vaccine Sputnik V. After necessary approval from the DCGA, Sputnik V will be the third vaccine to get emergency use authorization from the drug regulator after Covishield and Covaxin. The clinical trial of the vaccine in India is being done by Dr. Reddy's lab. The Hyderabad-based multinational Indian pharma company Dr. Reddy's lab has also inked an agreement with the Russian Direct Investment Fund, RTIF, for supply of Russian vaccine in India. RTIF has claimed an effectiveness of 91.6% for the Sputnik V vaccine. Dr. Reddy's had applied for emergency use of Sputnik V in February this year. 11 fresh cases of COVID-19 positive have been reported in Nagaland today, taking the tally to 12,416. Health Minister S. Pangyapom in a tweet informed that 8 new cases were detected in Dimapur, 2 in Mogokchung and 1 from Kohima. With no recoveries reported, the total recovered cases remains at 11,992. Presently, the number of active cases has climbed to 167, while 83 persons have died due to the infection. Dwensang District Task Force for COVID-19 in its meeting held today discussed on reviving the check gate at 3rd NAB checkpost to collect a travel history and biodata in case of contact tracing purposes. Under the chairmanship of Deputy Commissioner Kumar Ramnikant, the members agreed to conduct massive awareness drive on COVID behaviors to contain the pandemic, wherein tribal leaders, ward leaders are given the responsibility for the same. The members also decided to activate Primary Health Centre and Community Health Centre for the COVID vaccination drive. It further decided to host a vaccination mela at Dwensang Town Hall on 13th and 14th of April. Wokha District Task Force on COVID-19 also held its meeting recently, wherein Deputy Commissioner and Chairman DTF Wokha Orentang Lotha said the district will reinforce the screening and registration of people coming to the district from outside the state and to conduct screening and testing for COVID-19 on all shopkeepers and businessmen. The Wokha DTF members decided that screening and registration for persons entering the district will be done at DE Hall, while the rest house will be converted into institutional quarantine. Department of Water Resources has launched the Kapukki MI project at Sonobudo village under Pradhan Mantri Krishi Sinchai Yojana, Har Khel Ko Bani 270 batch. Implemented under the Ministry of Jal Shakti, the project is estimated at a cost of 94,06,880 rupees. The work commenced in 2018-19 and was completed in 2019-20. With the construction of this project and the improved irrigation facilities, farmers can now undertake multiple cropping. The project was implemented with an active participation of the farmers so as to promote participatory irrigation management in the irrigation system. The department said with the completion of the project, it will now be handed to the beneficiaries for their use and future maintenance. And now 20 News, here are the main points again. Centre extends ceasefire agreements with NSCN Neokpao-Khitovi, NSCN Reformation and NSCN K-Khango for 1 more year till April next year. 168,912 new COVID-19 cases reported in the country in the past 24 hours. Centre bans export of Remdesivir and its active ingredients till COVID situation improves in the country. And Dimapur Police says newly constructed bridge over Dhansiri River will be open for one-way traffic only. That is all we have in this evening news bulletin. Good night.